This is our patient Jordan today. This is her first time to receive Dysport. She is interested in having it because she has some activity here between your eyebrows, shows your angry face. So you see those lines coming together, that's formed by a muscle here called the corrugator. Corrugator supercilii on both sides. Give me your angry face one more time. There's a separate muscle right there in the middle called the procerus, so that's the muscles that we're going to be treating today with our Dysport. In addition, we're going to be treating her forehead. Raise your eyebrows up for me there. You see these lines are developing here at rest. Go ahead and relax for us. And in case you're wondering why we have all these little white marks on her face, we have a separate device called the AccuVein, which helps us find any blood vessels that might be in the area of treatment and help decrease any risk of bruising she would have. Okay, you ready for your treatment today?
Yep.
Now, I always tell my patients I use what's called a distraction technique, so I'll be sort of wiggling your head like that during your treatment today. Okay? Go ahead and give me your angry face and relax. Okay, here's a distraction technique I was telling you about. Okay. And go ahead and relax. There you go. That was your very first treatment. Not too bad there?
Nope.
Very good. Go ahead and give me your angry face one more time and relax. The reason I have my patients show the activity is I want to see where the predominant part of that muscle is, the belly of that muscle is. And by finding that location, we treat that location, we're really treating where we need to be. The areas between the muscles that don't show as much activity, you don't want to inject in there because there's not as much that you can treat in those areas. Go ahead and give me your angry face again and relax. Go ahead and angry face and relax. The reason I have them relax between the treatment is the muscles relaxed. Makes it a little bit easier for our needle to go in, less discomfort there. Go ahead and give me your angry face again and relax. Now we're coming out here on the outside to treat the outside of those muscles I was telling you about, the corrugators. Good. Go ahead and give me your angry face and relax. And again, by having the activity there, we can see the areas of any sort of discomfort or any areas for activity. Angry face and relax. Last two injections right over here, sort of tops of these muscles here. Good, same thing on the other side. One more angry face and relax. Now the next area that we're going to be treating is going to be your forehead. Great. A couple little drops of blood there, nothing significant. Go ahead and hold that there for me. So again, the next muscle we're going to be treating is called the frontalis muscle. It's the forehead muscle. Okay, so you're going to be elevating your forehead. And she has a very active forehead. And patients with active forehead, I want to come over these sides over here. And all the way over there. Sometimes people will stay just in the middle, and that's going to get people who almost look like they've been treated when just the outside comes up. They'll give a look where the inside has no motion, the outside comes up really high, called the Mephisto look. You don't want that look, so when a patient does have a lot of activity, you want to make sure that your injector comes all the way out here to treat those areas as well. Go ahead and raise your eyebrows up for me, and relax. We come over here where we saw that peak of the forehead muscle moving there. Little injection there. Very good. Eyebrows up for me again, and relax. See right there, I probably would have gone if we hadn't marked that out ahead of time, but since we know there's a blood vessel right there, eyebrows up one more time for me. Move just a little bit to the inside. Go ahead and relax. There you go. We've got two more spots to go on your forehead here. Again, eyebrows up for me, and relax. And again, this is going to soften these horizontal lines that are coming across your forehead there. Eyebrows up for me. And relax. Very good. That's it. Your treatment's over. These little bumps you see on her face, those are going to go away in about 15 minutes. Easier than you thought it was going to be?
Oh, absolutely.
Very good.
My eyes water all the time, so I'm not crying. It was virtually pain-free.
Very good. Well, that's it. She'll start seeing her result from this because we use Dysport in about 1 to 3 days. It's going to reach its maximum effect probably about 10 to 14 days and last for somewhere around 3.5 to 4 months. Okay?